Hi, my name is Abby. I'm going to be your nurse today.
Hi, I'm Amber.
Can I have you state your name and date of birth for me?
It's Amber Sturts, and my birthday is 8/30/92.
Okay, so I'm going to take and do a little health history on you. Is that okay to do?
Yeah.
Okay, so to start off with, I was wondering what your chief complaint is of why you're in here today.
My stomach is really bothering me. I'm not
Okay.
sure why. It hurts.
Okay, what is like the history of your current illness? Like, how long have you had this problem?
It's been going on for about a week, but the past 2 days it's gotten really bad.
Okay, so I will put that down. Can you tell me, are you on any types of medications? And by medications, I mean, are you on any like prescriptions that your doctors prescribed for you?
No.
What about like anything over the counter, like Tylenol, aspirin, any of that?
No, I only take like Tylenol whenever I have a headache.
Okay. Are you on any types of supplements?
Like supplements, you mean like vitamins or like workout supplements?
Any, I guess.
I do some like pre-workout drinks.
Okay. And are those like vitamin drinks or what are they?
They're vitamins, some energy drinks.
Okay. Do you have any types of allergies?
The only time I really get like itchy eyes or anything like that is in the summer, or not the summer, like the springtime, late spring, early summer, and then fall.
Okay.
Like hay, I'm guessing.
Okay. Do you have any allergies to any types of medications that you know of?
No, I don't think so.
What about any types of foods? Have they ever told you you're allergic to any foods?
No.
Okay. Can you tell me a little bit about your medical history? And by medical history, I mean like any hospitalizations that you've ever had or surgeries, or if they've ever diagnosed you with anything.
I've had surgery and I had my tonsils and my adenoids removed. Gosh, I think I was probably like 12,
Okay.
10. I'm not sure how old I was,
Okay.
but it was the 5th grade, if that helps.
Okay.
I went, one time I thought I was having like problems with my appendix and I went to the emergency room, but it wasn't anything.
Okay. And they didn't put you, like admit you to the hospital or anything?
No.
Okay. No. Vaccinations. Are you up to date on your vaccinations? Do you know?
I think I am, yeah.
Okay. And another one I have is with flu season coming upon us, have you recently had a flu shot, or is that something you still have to get?
I had one the last year because I used to teach at a preschool,
Okay.
and they really recommended that, and so we got like free flu shots with our health insurance.
Okay. So is a flu shot something that you'd be interested in?
Maybe. Does it
Okay.
hurt?
No.
Okay.
Okay. Now can I have you tell me a little bit about your family history?
Yeah. Well, my dad's mom, she had breast cancer.
Okay.
She also shakes. I'm not sure what the name of that is, but she shakes. My mom has glaucoma and high blood pressure. My dad has hyperthyroidism, I think. Is that what that's called?
Like an overactive thyroid?
Yes.
Okay.
Yeah. We have several like cancers, like I said, the breast cancer, some skin cancers. Let's see, my grandpa had gout. I think some heart attacks
Okay.
and stuff.
That's a big one.
Yeah, and then gallbladders, I think.
Okay.
Yeah.
Do you know if anybody's had any kidney problems?
Yeah, I think my grandpa did.
Your grandpa? Okay.
Mhm.
So now I'm going to ask you a little bit about your personal and social history. So this
Okay.
is your daily life, anything that you do.
Okay. I work in an office,
Okay.
and so I sit a lot, and I don't like to sit. So I go to the gym, at lunchtime, and then after I get off work. I like to go out and eat Chinese. Is that
Okay. Yeah, that could be what your nutrition.
Yeah.
Are you pretty healthy other than liking to eat Chinese?
Yeah, I like to eat, like my daily fruits and vegetables. Um, I don't eat too many carbs.
Okay.
Yeah.
Um,
Is that what you wanted?
yeah.
Okay.
What is your living situation like?
Like, what do you mean?
Like, where do you live?
Oh, I live with my mom and dad.
Okay. Another one is education. Like, what's your highest level of education that you have?
I went to a 2-year college, so I have an Associate of Applied Science degree.
Okay. Okay. So now I'm going to get into some questions, and all I need you to do is to say yes or no on these.
Okay.
And there's about a little over 10, I believe, or more systems that we're going to go through. It's basically the whole body system. So
Okay.
I'm going to start with general. Can you tell me what your weight is?
It's like 140.2.
Okay. Have you had any recent weight gain or weight loss?
None recently. About 2 years ago, I started to. Oh yes.
Do you have any like fatigue or fatigue, which is tiredness, like you're tired?
Yes.
Okay. What about any weakness, like
No.
body weakness? Okay.
No.
So now we're gonna go on, and I'm gonna ask you a little bit about your skin. Have you noticed any recent changes in any moles on your body?
No.
No moles. Okay. What about like any rashes on your body that may concern you?
No.
Any itching?
No.
Dry skin.
Sometimes my hands get dry. So yes.
So yes. Okay. So now I'm gonna ask you a little bit about your basically your eyes, your ears, your nose, and your throat and your neck.
Okay.
Do you have any headaches?
Yes.
Okay. What about cold, like any current cold?
No.
Okay. Do you have a runny nose?
No.
Okay. What about a sore throat?
No.
No sore throat? Okay. So now I'm going to ask you about your neck. Do you have any pain when like turning your neck or moving it up and down?
No.
Do you have any neck stiffness?
No.
No? Okay. And what about, have you noticed like any lumps or any abnormalities about your neck?
No.
No? Okay. So now I'm going to ask you a little bit about your respiratory system. Do you have a cough? Like
No.
a present cough? Okay. What about trouble breathing?
No.
Do you have any wheezing ever?
Except for when I run.
Okay. Do you have a history of asthma or diagnosed with asthma?
Oh yes.
Yes, okay.
Yeah.
Now I'm going to ask you about cardiovascular, which is like your heart. Do you have high blood pressure?
No.
Okay. Is your blood pressure usually normal?
Yeah.
Okay. Do you have any trouble breathing? I think I asked you this one, but we'll ask you again.
No.
No? Okay. Do you have ever have chest pains?
Mm-mm.
No? Okay. So we're going to ask you a little bit about your stomach. Do you ever have stomach pains? I know you're in for stomach and abdominal, but like, do you always have stomach pains?
No.
Okay. What about heartburn?
No.
Okay. Have you ever had nausea, vomiting with these stomach pains?
No.
No? Okay.
I mean, I don't know.
Okay. Do you have any difficulty or trouble swallowing?
Yes.
Yes. Okay. Now I'm going to ask you about your peripheral, which is like your extremities. Do you ever have any leg cramps?
Yes.
Okay. Do you notice any swelling in your legs or feet at any time?
No.
Okay. What about varicose veins? Do you have any varicose veins present?
Yes.
Yes. Okay. Now I'm going to ask you a little about your urinary system. Do you have difficulty urinating?
No.
Do you ever feel a burning sensation?
Sometimes.
Sometimes? Okay. Do you ever feel like you pee a lot or have to urinate a lot or get up during the night to
Yes.
go? Yes. Okay. Do you feel any weakness?
Like going to the
Oh,
bathroom?
sorry. Next one. Muscle,
Okay.
like on your muscles, like your muscle
Okay.
skeletal system. Do you feel any weakness or any of that?
Mm-mm.
What about muscle or joint pain?
No.
No. Okay. What about like your range of motion? Are you able to like move your arms all the way around, move your like any part of your body?
Yeah.
Or okay.
Yeah.
And now I'm gonna ask you about your psychiatric, which is going to be like, do you have any depression?
Okay. Oh,
Do you-
no.
Okay. Anxiety,
What is anxiety?
like you're anxious all the time,
No.
or anxious about anything.
Well, sometimes.
Sometimes. Okay.
Yeah.
What about nervousness? Are you nervous?
No.
No. Okay.
No.
So now I'm going to ask you about your neurologic system. Do you have any numbness in any of parts of your body?
Yes.
What about a tingling sensation?
Yes. In my foot right now.
Okay. Have you had any seizures?
No.
No. Okay. Now I'm going to ask you a little bit about your, like, it's called the hematologic system, which is like your
Okay.
blood.
Okay.
Are you anemic, or have they ever thought about anemia?
No.
No? Okay. What about, do you bruise easily?
No.
No.
Mm-mm.
Blood loss?
No.
No? Okay. So now I'm going to ask you about your endocrine system, which is like, do you have an increased hunger?
No.
No? Okay. What about increased thirst?
Sometimes. Yeah.
Sometimes. Okay. Do you have any thyroid problems that you know of?
No, not me.
Okay. And what about, do you have any intolerance to heat or cold?
No.
Like, does either one bother you?
No.
Okay. Well, I will go ahead and finish documenting. Now, I've got it all wrote on my paper, so I'll go ahead and get it put into our system.
Okay.
And your physician or doctor should be in shortly with you and get you going and figure out what's going on with you.
All right.
So,
Thank you.
You're welcome. Thank you. Have a great day.
You too.